For a year and a half now, we've heard about serious symptoms that COVID-19 patients have endured. And tonight, doctors are racing to figure out how to treat symptoms that last long after people become infected.
It's called long COVID syndrome. Roughly 30% of people who get COVID also develop these long-term symptoms. And they face not just chronic illnesses, but financial difficulties because of the treatments.
Tonight, KPRC 2 investigator Bill Spencer has an in-depth look at the burdens some long haulers are facing.
I haven't gotten over COVID-19. Every day is suffering and agony. 18 months of living a nightmare every day.
Miranda Erlinson is a 28-year-old wife, mother, and former Austin school teacher battling what doctors are now calling long COVID syndrome, or long hauler's disease. These are people who no longer test positive for COVID, but are fighting the horrific effects of the disease months later. In fact, she went from running a half marathon before COVID to sitting in a wheelchair for 5 months.
I started to get tingling and I couldn't feel my feet, and I developed incredible weakness in my hands. I went to bed okay, and the next day I woke up, I couldn't walk.
For long haulers like Miranda, who's suffering from heart issues, extreme muscle weakness, breathing problems, and trouble swallowing, the sickness just goes on.
I cannot eat, I cannot sleep, I cannot rest, I cannot work, I can't rehab, and I can't get more scans because I can't afford them.
We're going to have this very large proportion of the population that is going to develop long-term care issues related to COVID, and it's going to be a substantial cost to the patient.
Dr. Louise Ostrowski works at the UT COVID Center of Excellence, just one of more than 80 clinics nationwide now specializing in treating long COVID patients.
Most people think that COVID is live or die disease, right? But there's a third outcome, which is in between living and dying, which is long COVID.
Dr. Ostrowski says the 4 most common problems long haulers are facing are deep fatigue, brain fog, the inability to think straight or concentrate, heart damage and rapid heartbeat, and lung damage, all of which can be very expensive to treat.
So we're going to start with clinic visits, with laboratory exams, radiological exams, testing of your lung function, of your heart function.
Just how expensive can battling long COVID become? Doctors say the relatively new virus and its unknown health impacts make it too early to really tell. But Professor Bruce Lee at the City University of New York says these patients could face bills of several $1,000s a month for the length of their treatment.
If you can't concentrate, or if you're having breathing issues or those things like that, that can threaten your employment. So if you have this double whammy where you may not be able to work and you have medical costs, then that could lead to potential financial disaster.
I owe $77,000. We spent our entire savings the first year. It took us 5 years to save that. I just want to get better and teach. It was my first year as a teacher, my first year.
She really has battled through so much, and she's only 28 years old. So what's the answer? How do you protect yourself from the health crisis of long COVID syndrome and the crushing costs of paying for it? Dr. Ostrowski says one way, get vaccinated now. We have an extended interview with the doctor at our website, clicktohouston.com. I'm Bill Spencer. KPRC 2 investigates.